Welcome to another episode of Explained by AI.
Today, we're going to equip you with some vital first aid knowledge,
Okay.
specifically for kids between 1 and 6 years old.
Oh, perfect.
So think of this as your essential toolkit
Yeah.
for handling those unexpected moments when a little one needs your help fast.
Yeah, it's like having a mental cheat sheet
Exactly.
ready to go.
Yeah.
Because, let's face it,
hmm
accidents happen.
Oh, they do.
And when they involve kids, knowing the right steps
Yeah.
can truly make all the difference.
Yeah, the first kind of rule of thumb, I would say, in any situation involving a child is to project an aura of calmness.
Right.
Your composure will directly impact the child,
Okay.
helping them to stay calm as well.
That makes a lot of sense. I mean, panicking wouldn't help anyone,
No.
especially a frightened child.
Exactly. So before you even approach the child, it's crucial to assess the environment.
Right.
Is the scene safe for both you and the child? Are there any immediate dangers that need addressing?
Gotcha. So always prioritize safety first.
Yes.
But what if it's a serious situation requiring immediate intervention?
If you find yourself facing a serious situation, the first and most crucial step is to call for help.
Okay.
Dial 112 without delay.
Got it.
While you're waiting for the paramedics to arrive, swiftly assess the child.
And this is where that lick, listen, feel method comes into play.
Indeed.
Right.
You're checking for signs of consciousness, listening for breathing, and looking for any obvious and severe injuries.
Right.
This initial assessment will guide your subsequent actions.
Okay, so let's delve into some common scenarios.
Sure.
Starting with choking,
Okay.
which can be quite frightening.
Recognizing the signs of choking is paramount.
Yeah.
If a child is grappling for breath, exhibiting bluish skin, or unable to make any sound, immediate action is required.
So the response differs based on the child's age, I imagine.
It does.
Okay.
For a child under 5, if they can cough, encourage them to do so.
Right.
If coughing proves an effective position, the child face down along your forearm, ensuring their head is lower than their body.
Okay.
Then deliver 5 firm blows between their shoulder blades.
So it's a targeted back pat with a bit more force.
If back blows fail to dislodge the object, the next step is to administer 5 abdominal thrusts.
Okay.
This technique is commonly known as the Heimlich maneuver.
And just to clarify, we're talking about swift upward thrusts slightly above the belly button.
Correct. Make a fist and apply firm inward and upward pressure just above the navel.
Okay.
Remember, abdominal thrusts can be forceful.
Yeah.
So a medical checkup is advised,
Right.
even if the child appears fine afterward.
Better to err on the side of caution?
Exactly. What about children over 5 years old?
Yeah. How does that change?
The Heimlich maneuver technique for older children involves a slight adjustment.
Okay.
Instead of kneeling, stand behind the child and circle their waist with your arms and position your fist just above their navel. The upward thrusts remain the same.
So the key is to adapt the positioning based on the child's size.
Precisely.
Gotcha.
Yeah.
If the airway remains completely obstructed and these techniques prove ineffective, immediately call 112
Yes.
for professional medical assistance.
Yes.
Okay, now let's shift our focus to another common mishap,
Okay.
falls and head injuries.
Falls can range in severity from a simple bump to something far more serious.
Right.
So comfort the child and examine them for any visible injuries.
So if it's a minor bump, can we apply a cold compress?
For bumps or swelling, applying a cold compress for 10 to 15 minutes can help alleviate pain and reduce swelling.
Oh.
However, it's vital to monitor the child closely for the ensuing 24 hours.
What warning signs should we be vigilant for?
Pay close attention to any behavioral changes such as unusual drowsiness, confusion, vomiting, or loss of consciousness. If any of these symptoms manifest,
All right.
or if you have any concerns, seeking medical advice is always the best course of action.
When it comes to head injuries, it's always better to be safe than sorry.
Let's move on to another potential hazard, burns,
Okay.
which can be quite distressing.
Burns always seem incredibly painful.
Burns require a swift assessment of their severity. A minor burn might present as redness, while more serious burns could involve blistering or even white or charred skin.
Oh, wow.
So how should we approach treating burns?
Yeah. How do we treat them?
The immediate response to a burn is crucial.
Yeah.
Hold the affected area under cool running water for a minimum of 10 minutes.
Okay.
This helps halt the burning process and provides pain relief.
What about clothing? Should it be removed?
If clothing is adhered to the burn, leave it undisturbed.
Gotcha.
If it's loose, stir it. Gently remove it,
Okay.
then cover the burn with a sterile, non-stick dressing or clean cling film.
Okay. Are there any common mistakes to avoid when treating burns?
Never apply butter ointments, toothpaste, or any home remedies to a burn.
Oh, really?
These substances can trap heat and exacerbate the injury.
That's good to know. In what circumstances should we seek emergency assistance for a burn?
If the burn exceeds the size of the child's hand, if it appears deep, or if it affects the face joints or genitals,
Right?
immediately call 112. These are indicative of a severe burn,
Gotcha.
requiring professional medical attention.
Okay, now let's address cuts and scrapes, an inevitable part of an active childhood.
Minor cuts and scrapes are commonplace, but handling them correctly is key to preventing infection.
What's the initial step in treating a cut or scrape?
First, apply direct pressure to the wound using a clean cloth.
Okay.
This will help control the bleeding.
Right.
Once the bleeding subsides, gently wash the wound with soap and water.
Is the use of antiseptic necessary?
Antiseptic isn't always required for minor cuts.
Okay.
Clean water and soap are usually sufficient.
Oh, yeah.
After cleaning, pat the wound dry and cover it with a sterile bandage or plaster.
So when should a cut warrant a doctor's attention?
If the cut is deep,
Okay.
if bleeding persists for more than 10 minutes despite applying pressure, or if the injury was caused by a rusty or contaminated object,
Right.
seeking medical help is imperative.
Okay, let's move on to poisoning, a situation that demands immediate action.
Poisoning necessitates a swift response.
Yeah.
The first and most crucial step is to contact 112 or your local emergency number.
Okay. While awaiting professional help, what can we do?
Try to ascertain what the child ingested
Right.
and retain the container or any remaining substance for the paramedics.
Okay.
This information will be invaluable in determining the appropriate treatment.
Our instinctive reaction might be to induce vomiting,
Yeah.
but is that actually advisable?
Contrary to popular belief, inducing vomiting is not recommended
Oh.
unless specifically instructed by a medical professional.
Wow.
It can potentially cause further harm in certain cases.
So the key is to call for help immediately
Yes.
and provide as much information as possible.
Exactly. What if the child comes into contact with poison on their skin or in their eyes?
Yeah, that's a good question.
If poison comes into contact with the skin or eyes, immediately flush the affected area with copious amounts of water. This will help dilute and remove the substance.
Okay, we've discussed numerous external injuries, but what about internal issues like a fever?
Fevers are prevalent in young children
Yeah.
and usually indicate that their body is combating an infection.
Okay.
Most fevers can be managed effectively at home.
So how can we assist a child experiencing a fever?
Prioritize rest
Okay.
and encourage them to drink plenty of fluids to prevent dehydration.
Right. The old advice was to bundle up a child with a fever, but now the recommendation is to keep them cool.
Precisely. Dress them lightly
Okay.
and ensure their room is well ventilated.
Right.
If the fever causes discomfort,
Yeah.
administer age-appropriate paracetamol.
Sometimes a fever can escalate into a frightening situation like a febrile seizure.
Febrile seizures are convulsions that can occur when a young child has a high fever.
Right.
They can be alarming to witness,
Yeah.
but are typically harmless.
Okay, so what should we do if a child experiences a febrile seizure?
The most important thing is to maintain your composure.
Right.
Move any objects away from the child to prevent injury,
Mm-hmm.
and gently position them on their side to ensure a clear airway.
Should we try to restrain their movements?
Resist the urge to restrain them or insert anything into their mouth.
Okay.
Febrile seizures usually subside within a few minutes.
What if the seizure persists for longer than 5 minutes?
If the seizure lasts longer than 5 minutes, call 112 without delay.
Okay. Insect bites and stings seem almost unavoidable,
Yeah.
especially during the warmer months.
Insect bites and stings are common occurrences and usually cause only minor discomfort.
So what's the best way to treat them?
If a stinger is present, remove it by scraping it out with a fingernail or a credit card.
Okay.
Avoid squeezing, as this can release more venom.
Then apply a cold compress to minimize swelling.
A soothing lotion or cream can also help relieve itching.
What if child has a known allergy to insect stings?
Allergic reactions to insect stings can be severe.
Right.
If your child has a known allergy, always keep an epinephrine autoinjector, like an EpiPen, readily available,
Okay.
and administer it immediately if they are stung.
Even if a child doesn't have a known allergy, we should still be vigilant for signs of an allergic reaction.
Absolutely.
Like
Be on the lookout for symptoms like difficulty breathing facial or throat swelling, or a rash that spreads beyond the sting site.
Wow.
These require immediate medical attention and a call to 112 too.
Okay, let's discuss fractures, a common childhood injury that can be quite debilitating.
Fractures necessitate immediate immobilization of the injured area.
Okay, what's the most effective way to immobilize a fracture?
Support the injured limb using a splint, or simply by gently holding it in place.
Okay.
Refrain from attempting to straighten or manipulate the bone.
Should we then head straight to the hospital?
Yes, call 112 or proceed to the nearest emergency room as quickly as possible
Okay.
for a comprehensive medical assessment and appropriate treatment.
Now let's address nosebleeds, a common occurrence, especially in dry climate.
Nosebleeds can be alarming, but they're usually not serious.
How can we effectively stop a nosebleed?
Instruct the child to sit upright and lean slightly forward.
Okay.
Pinch their nostrils together just below the bony part of their nose
Right.
and maintain steady pressure for 5 to 10 minutes.
What should we avoid doing when managing a nosebleed?
Don't allow the child to tilt their head backward or lie down.
Okay.
This can cause blood to flow down their throat, potentially leading to gagging or vomiting.
Right.
Also discourage them from sniffing or blowing their nose, as this can interfere with the clotting process.
When does a nosebleed warrant medical attention?
If the bleeding is excessive, if it persists for more than 15 minutes despite applying pressure,
Okay.
or if nosebleeds become a frequent occurrence, consulting a doctor is advisable.
Okay, let's talk about a scenario that every parent dreads: unconsciousness.
When a child becomes unconscious, the immediate priority is to check their breathing.
And how do we assess their breathing?
Observe their chest for any rise and fall.
Okay.
Listen for the sound of their breath,
Mm.
and feel for any air movement on your cheek.
Right.
If they're breathing but unconscious,
Yeah.
gently place them in the recovery position.
And the recovery position involves rolling them onto their side with their head tilted backward.
Precisely.
Right.
This position helps maintain an open airway and prevents choking on vomit or their tongue.
What if they're not breathing?
If there's no indication of breathing, initiate CPR without delay.
CPR is a serious intervention.
Indeed. It's a skill every parent and caregiver should acquire.
Yeah.
Knowing CPR can be truly life-saving.
Could you provide a concise overview of how to perform CPR on a child between 1 and 6 years old?
Certainly. Begin by checking for breathing for no more than 10 seconds.
Right.
If there's no sign of breathing,
Yeah.
administer 5 rescue breaths,
Okay.
then proceed with chest compressions.
Where should we position our hands for chest compressions?
Use one hand and apply firm pressure to the center of their chest directly between the nipples.
How much pressure should be applied?
The depth of compressions should be approximately 1/3 of the child's chest depth. It should be firm, but not excessive to avoid causing injury.
At what pace should the compressions be performed?
Aim for a rate of 100 to 120 compressions per minute.
Gotcha.
Counting out loud or using a song with a similar beat
Mhm.
can help maintain a steady rhythm.
So we alternate between 30 chest compressions and 2 rescue breaths,
Yes.
continuing until help arrives.
Exactly. Do not cease CPR until paramedics take over or the child resumes breathing independently.
CPR is physically demanding, but knowing this technique can be critical in an emergency.
The potential to save a life makes every effort worthwhile.
This has been an incredibly informative deep dive into the world of first aid for kids.
It's been my pleasure to share this vital information with you.
We've covered a vast amount of information today, but it's just the tip of the iceberg.
We encourage you to continue learning and seeking out reliable resources to enhance your first aid knowledge.
Remember, knowledge is power,
Yes.
especially when it comes to safeguarding the well-being of our little ones.
Absolutely.
Right.
We've equipped you with the information.
All right, now it's up to you to take action.
Go out there and enroll in a first aid course, refresh your memory, and strive to be the most prepared parent or caregiver you can be.
Remember, we're here to support you.
Awesome.
If you have any questions or require guidance, don't hesitate to reach out.
Thank you for joining us on this deep dive into first aid for kids.
Of course.
We trust you found it valuable and empowering.
Until next time, stay safe,
Yeah.
stay informed, and keep those little ones healthy and happy.
You know, it's remarkable how much first aid advice
Yeah.
has evolved, even in recent years.
I recall my mother advocating for butter on burns,
Oh.
but that's now considered as significant error.
Indeed, butter can trap heat, potentially exacerbating the burn.
Right.
The optimal approach is to use cool running water for at least 10 minutes.
Simple, yet remarkably effective. Another outdated practice involves tilting the head back during a nosebleed.
Ah, yes. That myth has been debunked.
Oh, yeah.
It can cause blood to flow down the throat, which is far from pleasant.
And potentially hazardous. The current recommendation is to lean slightly forward and pinch the nostrils.
Precisely. Maintaining clear airways and preventing unnecessary complications is key.
It's fascinating how minor adjustments to our approach can yield significant improvements in first aid.
Absolutely. It underscores the importance of staying abreast of the latest recommendations from medical professionals.
Speaking of staying updated, let's revisit CPR for children.
Oh!
We touched upon it earlier, but its critical nature warrants further exploration.
I concur. CPR possesses life-saving potential, and every parent and caregiver should feel confident in performing it.
Absolutely. So let's break it down step by step, starting with checking for breathing.
Position your ear close to the child's mouth and nose, while simultaneously observing their chest for any rise and fall.
Okay.
You're listening for the sound of their breath and feeling for any air movement on your cheek.
How long should this assessment take?
No more than 10 seconds.
Okay.
If you don't detect any signs of breathing, it's time to initiate CPR.
Commencing with 5 rescue breaths.
Precisely. Gently tilt the child's head back by lifting their chin.
Okay.
And pinch their nose closed. Seal your mouth over theirs. And deliver 5 slow, gentle breaths. Ensuring their chest rises with each breath.
Then we transition to chest compressions.
Correct. Position one hand in the center of the child's chest, directly between their nipples.
Okay.
Ensuring your fingers aren't touching their ribs is crucial.
How much pressure should we exert?
The compressions should depress the chest by approximately 1/3 of its depth.
Okay.
Firm, but not forceful enough to inflict injury.
What's the recommended compression rate?
Aim for 100 to 120 compressions per minute.
Gotcha.
Counting aloud or using a song with a similar rhythm can help maintain consistency.
So we alternate between 30 chest compressions and 2 rescue breaths, continuing this cycle until help arrives.
Precisely. Do not discontinue CPR until paramedics arrive or the child starts breathing independently.
CPR is physically demanding?
Yes.
But its mastery can make all the difference in an emergency?
The possibility of saving a life justifies every ounce of effort.
Let's switch gears and discuss another common ailment in young children.
Okay.
Febrile seizures.
Febrile seizures are convulsions triggered by a rapid increase in body temperature. They often occur in children between 6 months and 5 years of age.
They sound terrifying. What should we do if a child experiences a febrile seizure?
While frightening to witness,
Yeah.
febrile seizures are usually harmless and self-limiting.
Okay. Should we try to restrain the child's movements?
No. Never restrain a child during a febrile seizure.
Okay.
The most important thing is to keep them safe.
And how do we ensure their safety during a seizure?
Clear the area around the child to prevent injury.
Okay.
Place them on their side to maintain a clear airway. And loosen any tight clothing.
Should we try to put anything in their mouth?
Absolutely not. Never insert anything into a child's mouth during a seizure.
Okay.
It's dangerous and could obstruct their airway.
How long do febrile seizures typically last?
Most febrile seizures last less than a minute or 2.
Okay. When should we seek medical attention for a febrile seizure?
If the seizure lasts longer than 5 minutes.
Okay.
If the child doesn't regain consciousness afterward. Or if it's their first febrile seizure, call 911 immediately.
Let's delve into another concern for parents.
Okay.
Poisoning. It's a situation that requires immediate action.
Indeed, poisoning is a serious medical emergency that necessitates a swift and appropriate response.
What are the most common sources of poisoning in young children?
Household cleaners, medications, personal care products, and even certain plants can pose poisoning risks to curious toddlers.
What are the telltale signs of poisoning?
Symptoms can vary depending on the substance ingested, but may include nausea, vomiting, abdominal pain, drowsiness, confusion, seizures, or difficulty breathing.
Okay, what should we do if we suspect a child has ingested poison?
The first and most crucial step is to call the Poison Control Center at 800-222-2222. They will provide expert guidance based on the specific situation.
Should we try to induce vomiting?
Do not induce vomiting unless specifically instructed by the Poison Control Center
or
a medical professional.
What information should we have ready when calling the Poison Control Center?
Be prepared to provide the child's age and weight the name of the substance ingested if known,
Okay.
the amount ingested, and any symptoms the child is experiencing.
While awaiting instructions from the Poison Control Center, are there any immediate steps we can take?
If the child is conscious and alert,
Mm.
remove any remaining substance from their mouth
Okay.
and give them a small amount of water or milk to dilute the poison.
Are there any common misconceptions about poisoning that we should address?
One common myth is that ipecac syrup is an effective remedy for poisoning.
Really?
This is false.
Wow.
Ipecac syrup is no longer recommended and
Okay.
can actually be harmful.
What are some preventative measures we can take to reduce the risk of poisoning in our homes?
Store all potentially hazardous substances out of reach of children
Right.
in their original containers with child-proof caps.
Okay.
Never transfer chemicals or medications to unlabeled containers.
Speaking of preventative measures, let's discuss water safety.
Okay.
Drowning is a leading cause of accidental death in young children.
Water safety is paramount, especially for families with young children and access to pools or bodies of water.
What are some essential water safety tips for parents and caregivers?
Never leave a young child unsupervised near water, even for a moment.
Right.
Teach children to swim early and enroll them in age-appropriate swimming lessons.
Are flotation devices a reliable safety measure?
While flotation devices can provide buoyancy, they are not a substitute for adult supervision.
Right.
Always choose Coast Guard-approved life jackets and ensure they fit properly.
What about inflatable pools or baby baths?
Even small amounts of water can pose a drowning risk.
Yeah.
Never leave a child unattended in an inflatable pool or baby bath, even for a short time.
What should we do if we witness a child struggling in the water?
If you see a child in distress in the water, immediately call for help.
Right.
And attempt to reach them with a long object like a pole or a towel.
So we jump in to save them?
Only attempt a water rescue if you are a strong swimmer and trained in water safety techniques.
Okay.
Jumping in without proper training can put both you and the child at risk.
We've explored a wide array of first aid situations.
We have.
But what about those instances where it's unclear if a situation constitutes a true emergency?
It's a common dilemma
Right.
and a crucial one to address when in doubt.
Yeah.
Err on the side of caution. Consulting your doctor or seeking medical advice is always a prudent course of action.
So what specific red flags should prompt an immediate call to the doctor
Okay.
or a trip to the emergency room?
Situations involving loss of consciousness, seizures, difficulty breathing, or heavy bleeding
Right.
warrant immediate medical attention.
Those scenarios certainly sound alarming. Are there any less obvious signs that parents and caregivers should be vigilant for?
Pay close attention to any significant behavioral changes, such as extreme lethargy, irritability, or confusion.
Right.
These can be subtle indicators that something might be amiss.
And I imagine unusual symptoms that persist or worsen should also raise concern.
Absolutely. If you observe anything out of the ordinary that doesn't improve or deteriorates,
Right.
seeking medical evaluation is always the best approach.
Essentially, trust your instincts.
Yeah.
If something feels off,
Yeah,
don't hesitate to seek professional guidance.
precisely. You know your child best,
Right.
and your intuition is a powerful tool. When it comes to their health and well-being,
yeah.
it's always better to be safe than sorry.
Well, this deep dive into the world of first aid for kids has been incredibly enlightening.
It has been my pleasure
Yeah.
to share this vital information with you.
We've learned so much. And remember, this is just the beginning of your journey in becoming a more informed and prepared parent or caregiver.
We wholeheartedly encourage you to continue learning and honing your first aid skills.
Right.
The more prepared you are,
Yeah.
the more effectively you can respond to any situation that arises.
Knowledge is power. And when it comes to our children's well-being, that power is invaluable.
We've provided you with a solid foundation of information and insights. Now it's time to put that knowledge into action.
Right. Go out there, continue learning, practicing, and become a confident advocate for your child's health and safety.
We're always here to support you along the way. Don't hesitate to reach out if you have any questions or need guidance.
Thank you for joining us on this comprehensive exploration of first aid for children.
Of course.
We hope you found it both informative and empowering.
Until next time, stay safe, stay informed, and may your little ones thrive in health and happiness.
Do you have any topic that you would like to have explained? Drop it in the comments.